My name is Colleen Hole. I am with Advocate Health, the Atrium Health part of what is now a large organization, as you know. I've spent 40 years in healthcare as a nurse, administrator, and healthcare executive in hospitals, post-acute care, ambulatory care, population health. But at the start of the pandemic, was fortunate to have the opportunity to launch our hospital home program. So that's really why I'm here today speaking about the opportunities to leverage AI for home-based care programs. Well, the role of the patient, to be honest, has been in the background, I think, as we've developed health systems. We've built healthcare systems around place, mostly hospitals, around professions, largely physicians and caregivers, and payers. We build structures around how we can get paid. I am excited that finally, after 40 years, I see a pivot toward what matters to the patient. So their voice, though we survey them through traditional structures and surveys, I don't think we really get at it to the degree that we're really hearing what matters to them. So that's why I'm really excited about some of these new home-based care models, but are enabled by technology and AI. Sifting through what matters in all of that mound of data, just speaking first about clinical data, making sure it's risk adjusted, because we can compare readmission rates or length of stay or mortality rates, but without risk adjustment of demographics, race, ethnicity, disease state, all of those things, the data is meaningless. But it's often misused out there when people tout numbers that look good, but when you peel back the onion, you recognize it's not been risk adjusted. I think what I was speaking about a minute ago is the risk of just depersonalizing it at the human level. We're all part of that big data set, but the experience and that person's case is vastly different than the next person's. So I think we have to be careful about how we apply the intel from that big data to make sure that it ends up translating to something that has meaning for individuals. Yeah, I think trust is huge. I think even defining AI is still a bit of a mystery, both for us working in the field, but certainly to patients. We have patients, a few, who still don't have a cell phone because they're afraid of, can you hear what I'm saying through my cell phone? So we have a lot of work to do to build trust with our patients. And again, we are almost certainly patients ourselves at some point. So trusting what it's telling us as a clinician, at this point, I think it can guide direction, but we are nowhere near saying, yep, that's the answer. I think it certainly helps clinical decision-making, pointing in the right direction. Certainly, I see a huge application in our program with getting a heads up when a patient's starting to de-escalate or get in trouble, looking at the risk of this patient needing further care elevation. It's not going to say send the patient back to the hospital, but it can certainly give us a heads up and say, ooh, we probably should send someone to the home and take a look at that patient. But it's not, and I honestly don't think it will ever be the absolute, yep, here's the answer. It's still going to require critical thinking on the part of a human. It's a really great question, because I think it's going to be critical to do that. Often when we introduce technology, it actually created a barrier between us and the patient. When we started documenting in an EMR or EHR, all the positives were, wow, we've got one big data set. I know that my patient was just in the ER last week. I can say, are you taking your medicine? Because I can see all that. The truth is, it's still transactional. And in that moment, often the clinician is still over here working on their computer while the patient is over there. So unfortunately, I think we've depersonalized it because of the tech. I'm hopeful that we can use technology and AI to create a real human-to-human interaction. And I'm seeing glimpses of that as our nurses monitor how our patients are doing and we get trend lines. My nurse can pick up the phone and say, Mrs. Smith, it looks like you're anxious. Your heart rate's really up. Talk to me about what's going on. So those human connections, I'm hopeful and I believe can be enhanced, but we gotta check ourselves and make sure that we're not going, yep, that's what the monitor says, and not create the human interaction. I think we're going to have to continually not get so enamored with cool tech and lose, and I think I've already spoken to this, lose what matters most to patients, and that is caring, the actual human to human interaction of caring.